Thank you. So just to go over some of the later statistics, the numbers in Ontario have been in the 2,000 range. And so between yesterday and today, they were up 2,100, which is kind of a similar number to yesterday. And again, driven by Toronto. Ottawa had 90. The GTA area are the ones that are the driving sort of numbers. If we look at our numbers over the weekend, we had a relatively quieter weekend than we usually do. Our overall change was 30. That counts Friday, Saturday, and into Sunday. Yesterday we had a couple, and today we had a couple. So these are lower numbers that we're seeing. However, we did add 13 to Cornwall and 11 in SDNG, and a lot of these in SDNG actually, most of these were from an outbreak, and 600 Prescott Russell. So if you look at the actual rolling average, you can see that we're still hovering above the red. Overall, we're in the 48 range or so, again just above the red. We've got Prescott Russell a bit lower, but you can see again it's very stubborn. It's quite stubborn. It's just staying there, but again hinting towards the lower direction. And again, I think just the uptick here was due to one outbreak. I think there were 8 cases in one of them. And so that's why we're seeing that bit of an uptick there. So otherwise, we wouldn't have had that big uptick. Again, it's a matter of continuing this course, moving down into the next 2 weeks. As you know, the stay-at-home order has been extended, and hopefully we'll be able to be at very low levels when we come out and June 2nd, and hopefully not have to extend it. I know that a lot of us hoping that will be the end of the stay-at-home order. Again, it's pending, of course, provincial numbers going in the right direction, which now they are, and provincial numbers of vaccine delivery going into the right direction upwards, which they are as well. We have a new feature right now on our website now where we've also got, obviously by today we're close to 89,000 doses, because we're delivering several hundred today, and hospitals and others are delivering, so we haven't counted those yet, and we're going to long-term care homes right now, and we have a sort of vaccine summary here where it gives you an idea of where the doses were administered. Like I said, total 88,000, and where they're coming from. We out of the 10,300 doses that were given in long-term care residents and so on, about 3,000 of those were second dose. So those are the only ones. I know I had a question in the media: how many doses have we had in second dose? At this point, it's just 3,000, but we will be starting to keep a tally on those and start reporting those as part of our reporting mechanism moving forward. And again, this just brings you how many are given into what sites. Most of them, as you could see, are in our mass immunization clinics, over 61,000 in our mass immunization clinics. And we can also see that we've got quite good coverage of the elder groups, literally almost 100% of the elder groups, and very high of 60-69. So as we are going down, we will see an uptick in these numbers as well. A few things that have happened over this last couple of days. Obviously, this week we were supposed to go to plus 30, but because of the influx of vaccines, the number will go to 18 plus as of tomorrow morning, 8 a.m. Anybody 18 years of age and over, who was 18, it was 18 in 2003, that's what it is, will be eligible to book a vaccine. And so we know that now that essentially is all adults, regardless of where they work and what group or category they fall into. So we do anticipate getting more vaccine. We anticipate between now and the end, the last week of May, which is the May 31st week, that week, to have just our health unit itself delivered about 24,000 more vaccines. Between now and that, we only have two and a half thousand spots available. We will be adding clinics into June very shortly, as we are now working with the ministry and our partners in education. We will also be creating special clinics aside from these 24 clinics in June. That will be for school-age kids 12 to 17 and or their families. And so stay tuned for that. Those are above and beyond the numbers I've told you. I'm very happy to report that out of the 18 plus population, which is in our area 166,836, we've vaccinated approximately 89,000 people, which is 53%. Of our eligible adults. If we continue and don't include hospitals or anything or others between now and the last week of May, that goes into June, I think May 31st, we anticipate another 24,000 vaccines given just in our health unit clinics, and those exclude the schools. And if you add those up, we will be at about 113,000 first dose vaccines given by the last week of May into the beginning of June. That's about 68% of our adult population. And again, this does not take into account our hospitals or our other primary care distribution sites. So I'm quite happy about this because, as you know, the higher the numbers, the better it is for allowing a safe reopening. And you know that the federal government had looked at 75% as a target. I'm being more realistic. I'm looking at a 65, 70% sort of target as to when it's appropriate to start pulling back on some of the measures. And again, I'm talking first dose right now. And this means that at that point in time, we'll be able to switch and have individuals have their appointments moved earlier. We are getting some information now for people who have not yet booked a second dose. Stay tuned. The ministry is now putting in the ability to book a second dose if you had a first one already and you haven't received the second one, and there will be an ability to move up your dose. But we will be moving up those doses, like the 4-month intervals, to earlier, probably in June sometime. And stay tuned. It'll probably be done by age groups, 80, 70, 60 downwards, that can start having their second doses less than 4-month intervals. So again, these are all because of the fact that we're getting more vaccine. Speaking of vaccine, again, we're still waiting for, and again, as I've said it before, and I want to say it again, in terms of AstraZeneca, we're still waiting for directives from the ministry. The option is, again, giving another vaccine as a second dose, but likely giving AstraZeneca as a second, or offering AstraZeneca as a second dose. Stay tuned for that. I'm also very happy to report that over the next 2 weeks, we will be 44 pharmacies in our area will have received either Pfizer or Moderna. 27 will be receiving them in the this week, the week of May 17th, and another 17 will be receiving them the week of the 24th, next week. Among those is at least 9 in Cornwall. And so we are going to, that's great, because and this will be either Moderna or Pfizer. So that'll add to another opportunity for people to get vaccinated. And again, this will be open to everybody 18 and over as of tomorrow morning. So stay tuned for that. Again, good news in that regard. We knew this was coming, but I actually have the actual numbers here as well, and the proposed dates of delivery of that. These, as they get their stock in their pharmacy, they will be added to the website where people can go on and find locations at the ministry website that will tell them where they are. So all in all, we're headed in the right direction. Very, very grateful to our staff and to our partners who are helping us. The quicker we get it done, the quicker we can get out of the restrictions. Again, they will be slow, but at least we're having progress in that regard. Bonjour tout le monde, je vais commencer avec les chiffres ontariennes. Aujourd'hui, on a augmenté de 2170 cas depuis hier, et hier, c'est à peu près le même chiffre. Donc, on reste dans les 2000, les bas 2000, ça fait à peu près une semaine. Ça, c'est des bonnes nouvelles. On voit toujours les admissions de soins intensifs dans les 700, c'est encore un peu élevé, malgré que les admissions à l'hôpital sont diminuées. Aussi, On voit que c'est toujours le bureau de santé autour de Toronto. Ottawa avec 90. Nous, dans notre bureau de santé, ici, on est rendu en 178 cas actifs. Ce fin de semaine, on a ajouté une trentaine. Je vais le moitié, 11 à SDNJ. La plupart étaient d'une flambée qu'on a eu à SDNJ, 13 à Cornwall. On avait quelques flambées ici aussi et 6 à Prescott Russell. Je peux vous dire que ça, c'est pour les 3 jours, vendredi, samedi et dimanche. Je peux vous dire aussi que hier, on a eu, je pense, 3 et aujourd'hui, jusqu'au moment, on a eu 3 ou 4 cas. Donc, on voit dans la bonne direction. On peut voir au niveau des moyennes mobiles, encore, on a stabilisé un peu plus haut que la rouge ici, mais vous voyez qu'au niveau de la moyenne du Bureau de santé de l'Est Ontario, on est rendu à peu près à 48 par 7 jours par 100 000 populations. Nos bœufs est d'aller proche d'approcher l'orange ici qui est en bas de 25, mais je pense qu'on pourrait le faire d'ici 1, 2 semaines. N'oubliez pas qu'on a ajouté pas mal au niveau de la flambée, donc autrement, on sera un peu plus moins aujourd'hui, mais il faut continuer, il faut qu'on continue avec tout ça. J'aimerais vous aussi fait signaler que on a un autre sommaire sur cette page ici. En effet, on est rendu à presque 89 000 vaccinations données dans notre région parce qu'on a donné quelques centaines aujourd'hui. Donc, on approche 89 000 doses, qui représentent 53 % de la population. En effet, toute la population plus que 18 ans qui est éligible, c'est plus que 166 000 personnes. Donc, on est rendu à 53 % qui est de très bonne nouvelle pour nous. Et donc, on peut voir ici, on vous donne les chiffres dans tous les locales qu'on donne les cliniques au niveau des sites communautaires. Ça, c'est nos cliniques de bureaux de santé. On a donné la plupart des vaccins, comme vous voyez. Parmi les 10 000 qu'on a donnés aux résidents des maisons de longue durée et des maisons de retraite, à peu près 3 000 sont les deuxièmes doses aussi. Mais vous voyez, on voit que ça commence à augmenter les hôpitaux, nos unités mobiles, clientes à domicile, etc., les soins primaires et les pharmacies aussi, on a rendu à peu près à 8 000 quelques. Donc, vous voyez qu'on commence plus en plus à vraiment partager les vaccins à travers de notre communauté. Et donc, on est rendu à 88 000, à peu près 89 000 aujourd'hui. On voit ici le pourcentage de la population par l'âge et vous pouvez voir que vraiment, on est à peu près à 100 % des personnes 70 et plus. Et vous voyez, on est plus que 84 % au niveau de personnes de 60 à 69. Et avec le temps, vous allez voir plus en plus ces âges vont augmenter parce qu'on vient la semaine passée, on a passé à 50 avant, 40. Et comme vous savez, cette semaine, dès demain, on va mettre les âges à 18 ans et plus. Et à ce moment-là, tous les adultes de notre région qui veulent se vacciner, malgré s'ils travaillent il n'y a aucun groupe, c'est juste l'âge, on pourrait prendre un rendez-vous. Au niveau des vaccins, des planifications de vaccins, nous avons 24 prévus d'ici la dernière semaine du mois de mai, je pense la semaine du 31 mai, et on estime à peu près 24 000 autres doses de données. Et ça, ceci ne compte pas les doses aux hôpitaux et pharmacies ou soins primaires. Donc, si on rajoute les 24 000 aux 89 000 qu'on a aujourd'hui, on prévoit juste sans de compter les autres cliniques de vaccination, juste les nôtres, de bureaux de santé, on compte à peu près d'avoir vacciné 113 000 personnes. Ceci qui est à peu près 68 % de la population. Donc ça, c'était une très bonne nouvelle parce que, comme vous savez, le plus qu'on approche les 70, le plus que ça va être facile de commencer à diminuer et enlever les restrictions. Bien sûr, c'est la première dose. Et le fait qu'on va avoir vacciné 70 % de la population aux premières doses, je pense qu'on aurait une chance chance de rapetisser l'intervalle entre le premier et deuxième dose. Donc, il va y avoir des mécanismes où les personnes pourront aller prendre un rendez-vous pour leur deuxième dose s'ils n'ont pas encore un vaccin un rendez-vous de donner. Et si quelqu'un veut rapetisser ou peut le rapetisser, on va commencer avec les âges. Donc, les personnes de 80 ans et plus pourront aller sur le site web et changer. Mais ça, ce n'est pas encore un effet, mais je prévois que ça va arriver en mois de probablement de juin, mi-juin, fin juin. Aussi, en mois de juin, on est en train d'organiser avec nos partenaires dans les commissions scolaires des cliniques spécifiquement pour les enfants 12 à 17 ans et avec leurs parents s'ils veulent, donc les cliniques familiales. C'est à part des 24 cliniques qu'on va avoir d'ici le fin mai et on va le faire entre le 14 juin jusqu'au le 25 juin et la deuxième dose, on va booker la deuxième dose aussi pour ces enfants pour qu'ils puissent recevoir le deuxième dose avant le 22 août aussi. Donc, tout ça va être arrangé. On est en train de tout organiser. Donc, je pense qu'on va sur le bon pas. Une autre bonne nouvelle que nous avons, c'est que nos pharmacies dans notre région vont commencer à recevoir dès cette semaine soit Moderna ou soit Pfizer. En effet, cette semaine, le 17 mai, la semaine du 17 mai, on est sensible, il y a 27 pharmacies locales qui vont recevoir leur vaccin. Et la semaine du 24 mai, la semaine prochaine, un autre 17. Donc, on parle de 44 pharmacies dans notre région. Je pense que 8 ou 9 dans Cornwall qui vont recevoir soit le Pfizer, le Moderna, ça va commencer cette semaine. Une fois qu'ils reçoivent leur vaccin, pouvez aller sur le site web du ministère et vous allez voir la liste des pharmacies qui sont plus proches. Donc, avec le temps, on va voir plus les vaccins sont partagés dans la communauté. Donc, ça va faciliter l'accessibilité aux vaccins dans toute notre région, incluant soins primaires, pharmacies, etc. Donc, ça, c'est des telles bonnes nouvelles. Et une autre, juste en finissant, au niveau d'AstraZeneca, on n'est pas sûr encore qu'est-ce qu'on va faire avec la deuxième dose d'AstraZeneca dans notre région. On sait qu'il y en a des personnes qui vont naître dû. Pour AstraZeneca, c'est 12 semaines. Ça, c'est 12 semaines entre l'intervalle. Donc, il va y avoir deux options. Une, qu'ils vont être offerts l'AstraZeneca encore parce que le risque est très minime. C'est beaucoup moins avec la deuxième dose que la première dose, les caillots, où ils vont être offerts un autre vaccin. Donc, ça, c'est à suivre. Le gouvernement et Santé Canada sont en train de voir ça. Mais inquiétez-vous pas, vous allez recevoir votre deuxième dose. Donc, ça, c'est les nouvelles que je voudrais partager avec vous pour le moment. So I'm just going to go over some of the questions that I have here. There was an outstanding question here from Nelson last week about suicides. And Nelson, I've got the numbers here, and I can tell you that for example, in 2018, there were 30 suicides in our area. In 2019, there were 28. In 2020, in half the year, there were 17. So the rate per 100,000, if you prorate it, is a bit higher in 2020. It's 16.1 in terms of the rates as compared to 13 to 14 that we had the previous years. So we don't have the full rates of 2020, but we have the 6 month, which is 17, which at that rate is a bit higher than the previous year. What about ages 18 to 30? Is there a vaccination rollout plan for them? Yes, I just talked about it now. 18 is starting as of tomorrow. In Ontario, we are still shooting to open up completely alongside manageable endemic levels, call it the American approach, or have we adopted the pretense to crush the virus to zero? I think realistically speaking, Nelson, although it would probably be it would probably be great if we had no COVID. I don't think it's realistic that we'll ever have a COVID zero. I always call it COVID as near to zero as possible. That's what I call it, as low as possible. So I think that's important for us to do so. And I think when we're looking at reopening plans and reopening our community and reopening our businesses, we're actually looking at manageable levels with a high percentage of people vaccinated to really stunt or blunt any potential increase in transmission. And any transmission that would occur would be mild and would be very, very manageable, both in terms of the public health and also the acute care healthcare systems. I got another one from Glengarry News. How many people in our region have received AstraZeneca? It is approximately 3,100 individuals, 2,600 from pharmacies, and about 500 from our primary care offices. Could I confirm that there's been an outbreak at the windows, Farley's windows in Alexandria? Yes, that's the outbreak that I was talking about. We are in the process of investigating that right now. I have another question about second doses, and I've addressed that. And retirement homes they do have different guidelines than long-term care facilities, but they actually are starting to have a bit of a change in terms of visiting and outbreak management protocols, just like the long-term care facilities have. That was a question about long-term care, about retirement homes having modified restrictions now that virtually all of their residents are vaccinated fully. And by the way, just to say that we are now going to the long-term care homes to vaccinate for the second dose for all workers and all essential caregivers as well. But Jenna, that's it for me. If you have questions now, let's open it up.
Thank you, Dr. Powell. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Hi, Philip.
So my first question, youth 16 and 17 who qualify under the group 2 for vaccinations, they're still unable to book for the provincial system. For those people, what should they do to receive their first vaccination shot?
Stay tuned. I was on the call with the ministry, and they're just about to put that that age group in the booking system.
Okay. Given the success of the vaccine clinic last week in Morrisburg and the increased vaccine supply, when will the next clinic in Morrisburg be?
I don't know, but we're planning it for sure.
Okay.
I've got my team is actually. Let me just see. Hold on. I've got my just in case you find it yet. No, we haven't planned past the last week of May. So there will be one there for sure, or a few more, but we haven't planned that far yet.
Okay.
But we will. I can tell you, we'll be having a family clinic there.
Okay, perfect. Next question. Premier Ford said on the weekend that summer camps would be able to start beginning on July 3rd.
Yeah.
Given the federal government is flogging the one-dose summer mantra for the summer, do you think that we're going to be able to have things like youth recreation, team sports, swimming lessons, day camps in the EOHU?
Yeah,
this summer?
I do think so. I think so. I can't say July 3rd, but I can tell you that if all goes well, this is what's going to happen. Let's say now the stay-at-home order is removed, June 2nd. I see a slow reopening of amenities that were not previously opened. Obviously, outdoor and outdoor dining, for example, patios, those type of things. Gatherings of 5 to 10 people, for example. Then progressing into July, if all goes well, I'm seeing campgrounds opening, pools, beaches, even water parks with restrictions moving into July. And then progressively going into August, where you'll have more outdoor sports, team sports, those type of things, and indoor activities. So we can be, so I think that it's very realistic to say that in July there will be campgrounds open, again, pending the numbers and pending the vaccinations going upwards and the numbers going downwards, which so far is what's happening.
Okay, and just the last one, and I'm sorry to take up so much time here, but you said that with the more supply, that you're looking at changing the appointments that are already made for second doses to move them up sooner, into June even. But the Prime Minister said it's a one-dose summer. So you're saying that we could have a 2-dose summer here?
Yeah. As a matter of fact, students will be getting 2 doses. You know that, eh? That it'll be 2 doses. And we do anticipate, and not yet, but we do anticipate that at one point, Philip, we're actually going to be at a level where we vaccinated, look, 60, 70%, 75% of the people and that means that the vaccine coming in a lot of it will be able to go to second doses and second doses earlier. So what they're planning to do, and not right away, but they're going to, when we get to that equilibrium, when we get to that level, we'll then start to go say, okay, now 80-year-olds can change their appointment. There'll be mechanisms to change your appointment, can go online and make it earlier. Now 70-year-olds, now 60-year-olds, it'll be progressively that way. So I do believe that it will be for many people, not all people, but for many people. And the more we go into first dose being delivered, to June and July, that 4-month interval will be shorter between 2 doses.
Okay, great. Thank you very much.
No problem.
Next question, Eric O'Brien, City News. Please go ahead.
Hi, can you hear me?
Yes, I can.
How are you?
Good. Yourself?
I'm doing well. Just tell me, Dr. Paul, I know, I think it was 2 weeks ago that we had a chance to talk. You mentioned that this is what you wanted. You wanted this extension to be able to give yourself more time to get up towards that, I guess, community immunity.
Mm-hmm.
Do you think this is enough time on June 2nd?
You know what? I think it's enough time. It'll be enough time for our area. It'll likely be enough time for many Eastern Ontario Healthy Data areas. It may not be enough time for perhaps Toronto. So I think that if the government goes on a regional approach, like they did last year, we might open before others, depending on the numbers, because there are areas that are going to be in the right place, both in terms of vaccination and in terms of percentage of cases, cases in hospital and so on. So I do anticipate that we would be in a good position a couple of weeks from now. Don't forget, there's another 2 weeks. And if we continue those trends, we'll be in a more manageable position. Again, it all depends on what the numbers do. And if they continue this direction, I do anticipate it. I know some people may want another 2 weeks. But again, looking at the numbers and looking at, like I said, my colleagues in Toronto are a bit more apprehensive because of the fact that they have, the higher numbers. But I think that if they go with a regional approach, it may allow for large regions of the population of the Ontario to open, whereas others close. But if you have a large enough region, then you will, the temptation is if you have right next to you, somebody's closed and you're open, then you're going to go to the one that's open, right? So if it's large enough, then you could prevent that.
And just across the board, across Ontario, but certainly in the Eastern Ontario Health Unit, do you think that the influx of new vaccines, how much of an impact do you think that will have?
Well, I think it's going to have a big impact. It's going to bring us up to right now with the vaccine delivery that we're getting. We will by the week of May 31st have vaccinated about 68% of our population. And so if you look into going into then June, we can anticipate being, very high with, the numbers will allow us to not only reach a very good level of first dose, but to expedite the second dose delivery. And as you know, the end goal really is having, virtually everybody 2 doses. And that's when you start really seeing substantial drops in numbers, like we're seeing in other places. And that's where you'll start seeing a substantial modification of mask mandates and other things. Not completely normal, but much more normal than we've had in the last 18 months.
Thanks.
No problem.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hello, Dr. Paul.
Hi.
Okay, so I have 2 questions today.
Okay.
Are there any groups who are a priority for their second shots at the moment?
Yes, right now it's individuals who obviously who have cancer and are on chemotherapy or immunotherapy. We have individuals as well that are on that are dialysis patients. And at this point, we're also now giving it to the high priority group, acute healthcare workers that are front facing with patients with COVID.
Does that include dentists by any chance?
If they're in the high priority, yes, there is a listing that we have, and if they're exposed to potential exposure, yes, and it's in the high priority group, and I'm pretty sure they're in there.
Okay. And do you think it's conceivable that the congregate living outbreaks will go to 0 in the next few weeks?
I think so. We're down to 3 right now. We were to 21 a couple of weeks ago.
Okay, that's it. Thank you so much.
No problem.
Next question, Thomas Stockton, TVC 22. Please go ahead.
Good afternoon, Dr. Paul. Can you hear me?
Yes, I can.
Lovely. First of all, just a clarification. You mentioned about the registration for second doses and the ministry finally adding that to the website soon. Do we have a better idea of when that date's going to be?
No, Thomas. What they want to do is in terms of second dose, no, we'll know by the end of the week. I know they're working hard on it. They're doing 2 things. They're going to be changing the system to be able to, for those individuals that got their first dose but didn't get an appointment for second dose, to be able to book their second dose appointment. And it'll recognize your name because it's in the system, what vaccine you had. So let's say you had Pfizer, it'll book you in a Pfizer clinic, not into a Moderna clinic. And secondly, there will be the capacity once we start signaling to people that they can change their appointment to earlier by age group, there will be the capacity to do that. This latter, I'm not sure when that's going to happen. I anticipate the former one, booking second dose, would be made available earlier. We're just waiting. I know they're working hard on it because right now they just brought it down to 18 plus, and now they're working hard to bring it down to 16, 17. And very shortly, they're going to have to bring it to 12 to 17. So they got a lot of work cut out for them.
Yeah, it seems so indeed, yes. Carrying on, there seems to be a little bit of confusion, especially this weekend with such lovely weather, surrounding the closure of municipal boat launches. Can you clarify that a little bit for our region, please?
We have not had a clear response. Marinas are closed, and so by extension, we close boat launches except for emergency situations. I have asked the ministry 4 times whether boat launches can open, and I have not got a response. And that's why in the interim we said we will treat them as marinas, and I'm still trying to get a response, an interpretation by the ministry.
It's interesting, yeah, because it seems like they're opening up in Ottawa.
Yeah, that's what they've done there. But if you look at it, the regulation is silent on that.
Okay, and just finally, I just wanted to get your opinion on this one about, again, looking at AstraZeneca and the fact that we're being a little bit more restrictive here. Yeah, in the United Kingdom, they're plowing ahead with it. They're utilizing it still, and they have this whole time, and they are not really focusing so much on the issues we're seeing here. Why do you think, is it as big an issue there, or is it bigger here? Are we focusing too much on it? What's your thoughts?
No, the numbers, the cases that we've seen here are more, they're 1 in 65,000, whereas there was 1 in 250,000 or more. And that's why there was a bit of apprehension here. They're reevaluating it now, Thomas, and I'm not saying that they're not going to reinstitute it. Certainly, second dose is not an issue. I saw the numbers in Britain. They had 4 cases out of 4.5 million second doses. But what happened was the corresponding expectation of 1 dose per 250, even to 1 million, was brought down in Canada, specifically with the numbers, it was down to about 1 in 65,000. And out of precautionary principles, they wanted to look at more data and see, both for reassessing first dose use of AstraZeneca and second dose for AstraZeneca.
Do you have any idea why there was that disparity then between what's happening here and there?
I don't know. And that's exactly what surprised them. And that's exactly what triggered that pause in Ontario and in 2 other provinces in Canada as well, as you know.
Okay, great. Thank you for your time, Dr. Paul.
No problem.
Prochaine question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
Dr. Paul, vous venez de parler de la possibilité pour le territoire du BSEO d'avoir un été à 2 doses. Dans quelle mesure peut-on attribuer cette possibilité-là à la nouvelle approche qui est maintenant préconisée par la province?
En effet, écoutez, nous estimons que d'ici le 31 mai, la semaine du 31 mai, nous allons avoir vacciné première dose à peu près 68% de la population. Et on va recevoir beaucoup plus de vaccins en commencement de mois de juin, juillet et août. Ça va augmenter à chaque semaine. Donc, on prévoit avec 68%, 70% de la population première dose et le même débit de vaccin qu'il va recevoir, même plus, on aurait la capacité de commencer la deuxième dose un peu plus tôt que 4 mois entre les deux doses. Donc, ce sera fort probable qu'on va commencer à diminuer l'intervalle par les tranches d'âge. On va dire peut-être en mois de juin, on va donner deuxième dose plus vite, plus tôt que 4 mois chez les 80, chez les 70. On va aller comme ça 10 ans par 10 ans. Et n'oubliez pas aussi que pour les enfants, sûrement, ils vont recevoir 2 doses entre le mois de juin et le mois d'août pour qu'ils puissent être complètement vaccinés avant l'entrée d'école. Donc, ces deux choses-là me disent, surtout les statistiques que nous avons et le pourcentage de la population qu'on aura vacciné d'ici fin mai, et le fait que le débit de vaccin va augmenter, c'est logique qu'on pourrait commencer à donner la deuxième dose de façon un peu plus tôt que prévu avant.
Merci beaucoup, Dr. Paul.
Pas de problème, Denis.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. I'm back like Detective Columbo. The question I forgot to ask before, since you're involved with pediatrics and on the education table and so on, any update on back to school this spring?
I can tell you that we were looking again week to week, and we had contemplated either opening May 25th, the day after Victoria Day, or May 31st. That's pending, obviously, the Education Ministry approval of it. From our point of view, we estimate that by the end of the month, we'll have manageable numbers in our area to be able to have a safe return to school. But again, there are other many factors. I think, however, if nothing happens, between now and May 31st, they're not going to open. But we haven't ruled out them not opening at this point.
In a regional approach or province-wide?
Likely a regional approach.
Okay, thank you.
You're welcome.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you, Jenna.